Hi everyone, welcome to Health Coach Sunny. Today I'm going to talk to you about acid reflux. Acid reflux is also called GERD, gastroesophageal reflux disease. It's very common and very troublesome. Many of you may take over-the-counter supplements, but some of others just seem like nothing can work for them, so they take prescription drugs such as Protonix, Prilosec, Dexilant, Nexium, etc. The other day I had a patient. She's been taking Protonix for over 20 years and now she has very poor bones. One of the side effects of this category drugs is loss of bone density. You may not see it right away, but it's after several years or many years later. She's been dealing with the bone pain and joint pain. It's just very sad. It affects her quality of life. She wished that she knew the side effects many years ago, so she would not take this for so long. So here's the purpose of this video. I want you to not always look for a quick fix. If it's a life-threatening, yes, quick fix. But if it's a chronic illness, let's try to find a natural remedy first, because natural remedy usually has no side effects or very little side effects. Compared to prescription drugs, the side effects are usually this long. So let's look at the diagram and understand acid reflux. This is a healthy stomach and a healthy lower esophageal sphincter and esophagus. The main function of the sphincter right here is when you eat food, it allows the food to go down but does not allow the food to reflux back. So if this sphincter is not closed very well, you tend to have acid reflux frequently. So many people would think, my doctor giving me acid suppressant, so that means my acid reflux is caused by too much acid, so I need to take a prescription drug to prevent the acid from producing, therefore lower the acid level in the stomach. That's what the drug does, but usually it's not going to work for you long term, because for most of the people, the acid reflux disease is actually not caused by too much acid in the stomach. It's actually caused by too little acid in the stomach. Because if the acid in the stomach is too little, every time you swallow foods, the foods just sit here unable to be digested and move on to the intestine. When the food sits here for a prolonged period of time, it creates pressure to the lower esophageal sphincter. When the pressure constantly exerts to this area, the sphincter loses tone. So it cannot close very tightly when it's supposed to, like this. So when the food is here, it will reflux back. So please understand, for most of people, when you have acid reflux in the beginning, it's not usually caused by too much acid. It can be caused by too little acid. So by taking a prescription drug to lower the acid level in the stomach, it's not going to do any good long term. So how can we take care of this problem if we don't take a prescription drug? There are several natural remedies. Let's explore. Number one, healthy lifestyle. That means no alcohol, no smoking. That means you need to avoid triggering foods. For some people, it may be just simple tomatoes, spicy foods, but for others, it could be fried foods, sausages. So whatever that trigger your symptoms, you should avoid. Maintain a healthy weight. You can imagine if anybody has a big stomach or the abdomen, that's what I'm actually referring to, it will push the content in the stomach up and it will create the pressure to the esophagus, thus has the acid reflux. Number two, avoid constipation. Constipation is very common. If you have this problem, please look at my other video for a natural remedy to cure chronic constipation. You can supplement with the probiotic and eat a very healthy food that's full of prebiotics. Prebiotics means the food that you can use to feed the probiotic, the bacteria in the probiotic. Next one, use Tums or calcium carbonate responsibly. It's okay to use Tums or calcium carbonate occasionally, but don't chew it like candy, because if you do too much, you may end up with kidney stones. Then that's not good. Just look at the label and make sure you're not doing too much. Number 4, try apple cider vinegar before each meal. You can buy the capsule and just take before meals. What it does is it helps digest the food in the stomach instead of just sitting there for a prolonged period of time. It helps digest and it moves down. The last one is very important. It's called the sodium alginate. So this one is what I strongly recommend my patients start to take it. It actually creates a raft on top of the stomach right near the lower esophageal sphincter, so the food will not have a chance to reflux back. Let's look at the diagram again. So if you create a raft right here, it does not really matter your sphincter is fully closed or it's loose. So it will prevent food from refluxing back to the esophagus. So remember, your acid reflux disease is not always caused by too much acid in the stomach. On the other side, it actually might be caused by too little stomach acid. So before you ask your doctor for a prescription drug for acid reflux next time, remember, try natural remedy to treat your illnesses before you reach for prescription drugs.